Now at 6:30, it is a hospital that has faded into history but hasn't left the hearts and minds of those who walked its halls. Homer G. Phillips Hospital came to fruition during a time of strict segregation in the city of St. Louis. It was the only hospital in the city run by and for African Americans, and over time it became a premier training facility for black nurses and physicians. This Black History Month, Justin Andrews has more on a man making it his mission to take what he learned at the facility to help his community, and his work goes far beyond healthcare.
Let's see.
Searching these newspaper archives.
Let me see if I can find something.
This hand holds history.
I owe it to my people.
His people. Black people. Dr. Donald Suggs, a retired oral surgeon, began training at Homer G. Phillips Hospital in 1957, but he saw healing was more than just focusing on the physical.
An opportunity to be of service to your community.
Since 1984, Suggs has been the sole publisher and owner of the St. Louis American. For more than 40 years, he's wielded words. It was the 1980s, at a time when black voices were still muted in the media. Suggs helped command conversations that forged the future.
But I figured that, if you have a newspaper, you'd have influence.
Under Suggs, the National Newspaper Publishers Association named the St. Louis American the #1 black newspaper in the country at least 12 times. His passion for the press is his headline now. But the front page of this story was created in 1928. The paper became a social register for blacks in the Gateway City. St. Louis was the jewel of the Midwest, yet one of the most segregated cities in our country. The American was written by several black businessmen, including Homer G. Phillips. You mentioned this, but Homer G., one of the original investors.
Investors, yes, the American, yes. We're very proud of that.
Attorney and activist, Homer G. Phillips. Born in 1880, birthplace, Sedalia, Missouri, roughly 190 miles west of St. Louis. Phillips moved here in 1904. Homer G. became prominent in politics and spent years deconstructing racist policies. He ended up leading the campaign to open the only public hospital dedicated to serving blacks. But before he could witness the hospital's rise, on June 19, 1931, Phillips was shot to death while waiting on a streetcar. A year later, in the Ville neighborhood, known as a historic black self-sustaining hub, construction began on building a beacon of hope. Each brick ultimately erecting more than just a 680-plus bed, 5-building campus. The hospital was the heartbeat of St. Louis's black community.
It was elite. It was a sanctuary.
This is how Homer G. Phillips Hospital looked at its dedication in 1937.
It didn't just affect the people that were right here in St. Louis. It affected people through all the 50 states and all through the world.
Just 7 years after opening, the hospital was training a third of the graduates from the 2 black medical schools in the United States. And within 20 years, the facility had the distinction of training the largest number of black physicians and nurses in the world.
The way they trained us, they made us proud but not prideful. They taught us professionalism. They taught us that no matter where your patient came from, you treated all of your patients alike.
Lois Collier-Jackson graduated from Homer G's nursing school in 1963. She practiced nursing for at least 50 years.
And we were taught well. We were segregated, but we were taught well.
She's part of the Homer G. Phillips Nurses Alumni, a group aiming to keep what the hospital's namesake stood for alive.
There'll never be another Homer G. Phillips Hospital. That's it. There's no comparison.
Why won't there be?
Because you can't repeat history.
Our history has been unfortunately suppressed or whitewashed, even dismantled.
And this doctor refuses to let that happen. Dr. Will Ross.
This is not just a Homer G. Phillips story. This is a St. Louis story.
Dr. Ross is Washington University's Associate Dean for Diversity and a professor of medicine in the nephrology division. He has dedicated more than 2 decades to strengthening healthcare equity.
And that's why the hospital did so well, because you walked in a hospital and you knew you were cared for. People trusted you.
Dr. Ross started the annual Homer G. Phillips Lecture Series at WashU in 1996, recognizing, educating, and preserving the hospital's legacy. His mission today pulses with the pioneering work of Homer G., helping the underserved.
That institution was an anchor. It was a medical anchor, but it was an economic anchor. It was a cultural anchor. And because it prospered, the rest of the city prospered.
Homer G. Phillips Hospital was committed to healing the gaps in healthcare.
They weren't allowing African-American doctors to be on staff at Jewish, Barnes, Mobap. None of those. DePaul, none of those.
It's sad because it still wasn't enough.
It wasn't enough.
In the 1970s, the city of St. Louis started looking at closing hospitals. And in '79, Homer G. Phillips Hospital closed its doors. But it didn't go down easily. The decision sparked protests and marches to City Hall. I am standing inside what was once Homer G. Phillips Hospital. Today, it's now a senior living apartment. Well, it closed nearly 50 years ago, but its loss still felt today.
Good hospitals, the core is you're going to have good physicians. You can have great administrators. So the core of a newspaper is you have to have some decent journalism.
Suggs says progress isn't just made in hospitals or headlines, but it's in the hearts of those who dare to demand more. Homer G. gave black doctors a place to heal. Suggs gives black voices a place to be heard. News about blacks, for blacks, in a paper owned by blacks, that is still the St. Louis American's mission 97 years later. Whether your name is Lois Collier-Jackson,
I still feel that pride.
And I think it was really unappreciated. The quality of care, the quality of people there, it was just not really recognized. They never quite got their due.
Dr. Will Ross or Dr. Donald Suggs.
That's my sensibility.
These healthcare professionals realize treating patients goes much deeper than diagnosing ailments. Healing isn't just physical. The mission is to holistically heal, ensuring Homer G's pulse of progress beats forever. In the Ville neighborhood, I'm Justin Andrews, First Alert 4.
And you can watch all of our Black History Month stories, and we've had a lot of good ones. You can watch those right now on firstalert4.com.